Hello friends, welcome back. In this session, I am going to discuss about the mechanism, types, complications, as well as medical legal importance of skull fractures. This skull fractures comes under the chapter Regional Injuries in Forensic Medicine. Myself, Dr. Srinivasan from Chettinad Hospital and Research Institute, Chennai. Skull is a diploic bone consisting of two tables, that is outer and inner table. If you compare the thickness, outer table is twice the thickness of the inner table. Separating the outer table and inner table is the middle part, that is the soft cancellous bone called diploe. The diploic veins are located in the diploe, which drains the blood from the skull bones into the dural venous sinuses, as represented by the green color here. Coming to thickness of various parts of the skull bone. Occipital bone in the midline is the thickest part, that is around 1.5 centimeter or 15 millimeter. Then comes the frontal bone 8 millimeter, then parietal 7 millimeter. Thinnest is the squamous part of the temporal bone, which is 4 millimeter. It can be remembered by the mnemonic after office to party, where O represents the occipital bone. Then in the descending sequence, F for frontal, party, R for parietal, and T for temporal bone. Fracture means break or disruption of the bone. According to surgical classification, there are two types of skull fractures. One is the closed skull fracture, where the skin is intact. Here, as you are seeing in this newborn baby, there is a congenital depressor fracture, but overlying scalp is intact here. This is an example for closed skull fracture. Other is the compound skull fracture or open skull fracture. Open means the fractured site is open to the exterior. So there is chance of transmission of microorganisms resulting in the spread of infection into the meninges or even the brain also. So open skull fractures are more dangerous compared to closed skull fractures as far as the risk of infection is concerned. This is the skull fracture, that is the current classification of the skull fractures. A British neurosurgeon George Frederick Robotham has intensively studied the head injuries and postulated various mechanisms for resulting in the skull fractures. According to Robotham hypothesis, this is his work, Acute Injuries of the Head, written by Robotham. There are two mechanisms resulting in skull fracture. One is the direct force resulting in fracture of the skull. Example for direct force resulting in fracture skull is the stone. Suppose you are throwing stone, that stone at high speed hits the head, resulting in skull fracture of the frontal bone in this image. Or object is stationary, but sometimes skull goes and hits the object, resulting in skull fracture. For example, a person riding the two-wheeler at high speed suddenly skid and fell onto the ground, resulting in the skull fracture when the head hits the hard road, right? Or any object like stones or bullets comes and strikes the head. Or the in case of runover accidents, the head is crushed due to giant trolley wheel moving onto the skull. These are example for direct force acting on the skull. Either the skull comes in contact with the object, or object comes and hits the skull, or in case of runover accidents where the skull is crushed by the giant bus or lorry wheels. Second type, as far as mechanism of skull fracture, is the indirect force resulting in indirect fracture of the skull. That is, force is not acting directly on the skull. Force is on some other site away from the skull, yet the skull fracture results. Classic example is, suppose a person falling from the terrace of a tall building or a tall tree, and suddenly he lands onto his feet or in the sitting position onto his buttock. Due to sudden deceleration of the moving body, the force will be transmitted along the spine, resulting in thrusting of the spine over the base of the skull, which results in the linear fracture around the foramen magnum, in a fashion of ring around the foramen magnum, separating the skull base from the spine. That is called a ring fracture. Another example for indirect force is the, in case of boxing, see here you are seeing a person landing on the feet resulting in a ring fracture, or landing on the buttock resulting in the ring fracture around the base of the skull. As you are seeing in this boxing, the uppercut, there the forceful punch is made below the mandible or chin. That force will be transmitted through the mandible into the this anterior cranial fossa of the base of the skull, resulting in fracture of cribriform plate of ethmoid bone. These two are some examples for indirect force, where force is acting away from the skull, but yet the skull fractures, especially involving the base, occurs. Coming to direct force fracture, again they are divided into fracture due to local deformation, fracture due to general deformation. Local deformation means force is acting on the narrowed area or a small area on the skull. For example, I take the object with a small striking surface like this hammer, right? If I make a blow on this like this, that results in, the skull is a elastic sphere. These skull bones are relatively elastic. So, at the time of impact, due to elastic nature of the skull, there will be an intuition occurs, right? Inbending occurs at the site of impact involving the outer and inner table. As the skull contents are incompressible, this results in the simultaneous bulge away from the site of impact, or out, that is called outbending or extrusion effect, right? The site of impact, inbending, surrounding area will be showing extrusion or outbending, right? If the force is minimal due to normal elasticity of the skull, it skull resumes, okay? The rebounding occurs and skull assumes the original position, right? Suppose if there is a sustained force, or force of impact is at a very high speed, then which exceeds the normal elasticity or threshold of the skull, then that results in the fracture here, right? Fracture occurs where there is maximum stress occurs. As you are seeing in this image, where the hammer blow occurs, the inbending occurs. So the inner table fractures here and the inbending. Whereas the outbending or extrusion, the outer table fractures here, which is at the maximum stress there, right? This is how the fracture occurs as far as the local deformation is concerned. This is called a struck hoop analogy, right? Again, I am explaining here, due to local impact, the direct force acting, the hammer blow causing intrusion at the site of impact. As the skull contents are incompressible, there will be resultant outbulging or extrusion in the surrounding areas. So when the force is very high, or there is a sustained force is impact is sustained, then there will be a fracture in the inner table at the site of inbending, and a fracture of outer table at the sites of outbending, right? This is called a struck hoop analogy. Coming to fracture due to gender deformation under a direct force. As per Robertham's hypothesis, as I told, skull behaves like an elastic sphere, right? When skull is compressed in one plane, it bulges in other directions, resulting in increase in diameter of the other planes. For example, as you are seeing in this picture, the runover accident over the head, as the lorry tire passes over the head. Suppose a person is lying with the head side right onto the road, and the lorry tire runs over the skull and the laterally, right, pressing the temporal as well as the side of the parietal bone. So as there is compression between the hard ground and the overlying RE wheel, so there is a decrease in the transverse diameter of the skull, but there will be increase in the vertical diameter as well as increase in the longitudinal diameter, right? This is the longitudinal, this is the transverse diameter, and this is the height is the vertical diameter. So if it is pressed laterally, there will be decrease in the transverse diameter, whereas the other two planes, that is the longitudinal and the vertical planes, will be increased. So parallel to the axis of compression, there occurs a fracture right? At the sagittal plane as well as in the midline of the base also. Okay, fracture occurs in the midline here, as you are seeing here. The side compression fracture occur above along the sagittal sutures like this, right? As well as in the midline of the base also, parallel to the axis of compression. Always fracture occur parallel to the axis. In this here, a longitudinal fracture occurs. Suppose skull is compressed in this direction, the front and back. Now, this longitudinal diameter is decreased, but the transverse diameter as well as vertical diameter will increase, right? So, if it is compressed parallel to the axis of compression, there occurs a fracture like the coronal plane, right? The transverse fractures occurs involving the skull vault as well as the base, right? But always a fracture occurs parallel to the axis of compression, right? This is called a Rowbotham's hypothesis. Coming to types of skull fractures, there are multiple number of skull fractures as shown here. Most common is the fissured or linear fracture, where the fracture line is very thin and long, either straight or curved, involving the either outer or inner table or both tables, right? Second type is the depressor or signature fracture. Classic example is a hammer blow, where this square shape of the striking surface resulting in the square shaped fracture in the part where it is struck, right? It is also called a signature fracture or fracture a la signature, as the weapon leaves the signature of its shape onto the fracture site. You can identify the weapon. That is the second most common type after the fissured or linear fracture, that is the depressor fracture. The problem here is the depressor bone may undergo may go inside and result in the tearing of meninges as well as laceration of the brain, also may cause fatal brain lacerations. Comminuted or mosaic fracture means when two or more fracture lines dividing the skull fragments into three or more, then it is called comminuted or mosaic fractures, right? Also called a spider web fracture because of the radiating and as well as concentric uh, linear fracture lines, they're intersecting with each other, dividing the skull into multiple fragments. That is called producing a mosaic or spider web pattern here. If there is no displacement of the fractured fragments inside or outside, it is called a comminuted fracture. Sometimes the depressed fracture may be comminuted. Some fracture fragments may be driven into the cranial cavity. In that situation, it is called a depressed comminuted fracture. A type of depressed fracture is the pond or indented fracture, which is seen in the infants, a child under 4 years, as the skull is elastic. Any local focal impact, like obstetric forceps blade gripping the fetal head during delivery, or the fetal head is pressed against the protruding areas like that sacral promontory or spines, that will produce a local indentation with intact inner table, right? Three eyes for indented, that is the intact inner table seen in infants, and the indentation occurs. It's also called a pond fracture. Gutter fracture means a tangential strike, by the bullet, which is a glancing bullet, or a tangential strike with a sword, etc. Along oblique strike like that, there will be a fracture of this outer table alone, resulting in a gutter or a furrow formation involving the outer table, where the inner table is intact. That is called a gutter fracture. Ring fracture or foramen fracture, we already explained. Person falling onto the feet or buttock, resulting in the ring fracture around the foramen magnum. Diastatic or suture fractures occurs in the young individuals and the children, as well as adults less than 30 years, due to non-fusion of these cranial sutures, commonly involving the sagittal sutures, where the fracture line runs along the cranial sutures. Okay, there will be a fracture separation of the skull bones along the suture lines. They are called a diastatic or suture fracture. Perforating fracture means there is a through and through fracture, right? Example, a bullet strikes here, makes an entry and makes an exit in the opposite side. So, one entry and on exit, a clean punch-out holes are made on either side, both the entry and exit. That is called perforating skull fractures. Whereas penetrating skull fractures means if I strike with the that nail remover like this, with the two projecting area pointed ends, it will cause a penetrating where there is a punctured defect, two punctured defect on the skull, but it doesn't make any exit, right? So only when a entry is there, there is no exit. Suppose the bullet pierces the skull here, and then it loses momentum and lodges in the brain substance itself without making exit in the outer table. It is lodged in the brain itself with only entry hole. That is called penetrating, right? When both entry and exit is there, perforating fracture. Only penetrating fracture, only the entry wound is there, it is called a penetrating fracture, right? Blowout fracture means a punch on the orbit that result in the fracture of the floor as well as the medial wall of the orbit, resulting in this blowout fracture, right? Expressed means skull is shattered into multiple pieces that commonly occur in the contact or very close shot of the firearms due to forceful entry of gases under expansion into the small cranial cavity that causes the resulting in the mutilation or busting out of the skull, resulting in busted head where the skull pieces are shattered, right? That may be thrown out and lying in the vicinity of the body, right? That is called a explosive fracture. Shattered into multiple pieces occur in a gunshot as well as bomb blast injuries. Elevator fracture uh, means if I take a sword, or if I take a hatchet like this and I make a strike over this skull bone, and while retrieving, okay, there is a lateral pull. When there is a lateral pull of the weapon while weapon is withdrawn, then that will result one end of the fractured fragment lying outside the contour, whereas the other end of the fracture goes inside the cranial cavity. So one end of the fractured fragment is elevated due to lateral pull while the weapon is retrieved. That is called a elevated fracture. Cut fracture means a chopper or a hatchet or bill hook like this is struck, then the cutting edge which is come in contact, as the skull is having a rounded contour, that part of the cutting edge which comes in contact, that part alone will be cut, resulting in a cut fracture, right? Whereas the edge of the weapon which is not come in contact won't produce any defect, right? Only a small cut fracture corresponding to the cutting edge will be produced. Then hinge or motorcyclist fracture occur especially when the person is skidding from the bike landing onto the side. There will be a fracture starting from the petrous part of temporal bone, crossing the mediastinal fossa along the sella turcica and ends at the opposite side petrous part of the temporal bone, right? One petrosal ridge to other petrosal ridge causing the sella turcica, right? That is called a hinge fracture or mortar section fracture. In this, due to complete division of the base, there will be a anterior and posterior halves of the base of the skull are divided into two parts, right? That is called a hinge or motorcyclist fracture, as is common in the motorcyclist who are skidding and falling at a great speed, striking his skull on that is right aspect of the head onto the ground. Coming to, so these are all the different types of skull fractures. These are the various mnemonics helpful to memorize these various types of skull fractures. This is all the various memory aids, right? Coming to complications of skull fractures, as we have seen, the depressed skull fracture, the depressed fragments may injure the underlying brain, resulting in fatality. Then, in case of open skull fractures, there may be risk of infection being spread into the cranial contents involving the meninges as well as the brain, resulting in meningitis, encephalitis, and all. Then, if there is a fracture involving the temporal parietal region, then there may be rupture of branches of middle meningeal artery resulting in development of extradural hemorrhage, again which may be fatal, right? Then there may be, after 1 or 2 years following the skull fractures, there may be traumatic epilepsy, right? Traumatic epilepsy resulting in recurrent chronic seizures in the patient after 1 or 2 years due to injury to the brain. These are all some common complications. And coming to medical importance of skull fractures, uh, even the fracture of the skull bone, even involving the outer table or inner table alone, that is considered as grievous hurt as per section 116 of BNS, that is a Bharatiya Nyaya Sanhita, right? So with this, we have come to the end of this discussion. Thank you very much. We will discuss in detail these all types of skull fractures in the subsequent videos. Thank you.